everyone. So today we'll be talking about the Manchester method. In facial reconstruction, it was developed in 1895 by a German anatomist. He was able to reconstruct the face of a German composer, Johann Sebastian Bach. The way he did this was kind of like the Manchester method. As you can see, it was developed by Nave in 1977, and they usually use this method in cold cases, and we'll get into more of that later on. This is the most common form of facial reconstruction that we use today. Why it is considered the best? It is considered the best because when you are sculpting somebody's face, you have to take into consideration the soft tissues and the muscles of the face. And when you are able to do this correctly, you are able to get more of an accurate representation of the person's face, and you're able to identify that easier than you would doing it incorrectly. So as you can see here in these three photos, you can kind of see the steps as how the face is gradually building to more look like a human face rather than just the skull. So what they do is they first put the skull onto an adjustable stand so they're able to move it, any which way that they need to get the muscles and tissues just perfectly. So before we even add on the clay structure, before they do drill holes with a 3mm drill bit, and they put pegs or markers, as you could say, into those holes to measure the depth of the face and the tissues that would be on the face. So each peg represents the level of depth that starts at that anatomical point. So the way you can look at the facial tissue is it helps determine the age, gender, build of the human being. And the muscles, when they add the muscles onto the face, they're using the muscles' exact origin and insertion to get those muscles looking how they're supposed to be looking. So as they are reconstructing the face, they do take in consideration the shape of the muscles that are on the face, which is a lot, but the size of the muscle actually is based off the underlying hard tissue that is on the muscle. So as they are building on the muscle and the tissue of the face, they do use a plastic eyeball, and they do place that in the orbit, so then that way they can start building around the eyeball and adding the eyelids, the eye muscle, and things like that to make it more look like a human face. And for some things, just like the nose, they do base that off of the bony nasal aperture and its width point as 3/5 of the overall width of the soft nose. So they do base that off of the nasal aperture, and that is how they are able to build that nose and to make it look as close as possible. So moving on to the face, they do look at the width of the mouth and how it corresponds with the 6 anterior teeth. The lips are determined by the upper and lower teeth. And the length of the ear is determined by the nose and the ear canal and how that is positioned using the external auditory meatus as the reference point. Muscles of the face are modeled on the skull, and they are reconstructed in clay, one muscle at a time, and a layer of clay will be added over the muscle to represent the skin, as well as the fats, and some strips of clay are rolled and they're shaped to added over the muscle fat structure to help maintain the length of the pegs and the guide for the final tissue guide over the face. Ways that this method is used today is they do use this in museums to help recreate historical figures. They do help with cold cases like I had mentioned before for the federal and local police, and used to help reconstruct descendants as well.